Hello, this is my case study. My client is 1,000 years old, male, purple-skinned, bald, 8'3", and physically fit. As a child, my client was born with purple skin, and this is caused by a deformity in his parents' gene pool, which caused him to look very different. Growing up, the client stated that his parents did not care for him well and that his peers treated him harshly because of his skin. This led to a begrudgment of everyone in the client's life, causing the client to outcast himself. The client then described an insatiable desire to prove himself and to prove everyone else whom he hated that they were wrong. This desire turned into power lust, which is where the root of many different issues take hold. The diagnosis. The client has two main diagnoses, being antisocial personality disorder as an F60.2 and a God complex as an F60.9. The antisocial personality disorder stems from being shunned as a child, leading to the breaking of laws and disregard of safety. A few examples of this include, but are not limited to, a relentless search for items he calls the Infinity Stones, the apparent murder of half the population on different planets, and need more confirmation on this is only what the client has told me, and apparent use and disposal of different species he calls the Black Order. The God complex stems from the belief of complete power in deciding the fate of the universe. The client has repeatedly said that they know what is best for everyone in the universe and that they are the only ones who have the will to act upon such a bold action. The intervention. Antisocial personality disorder is a difficult thing to treat. Psychotherapy or talk therapy has been shown to work the best so long as the patient is able to admit that there is an issue. Getting the client to see that violence isn't a way to handle issues is paramount. Many psychotherapy sessions would be required, given that the client is 1,000 years old. Cognitive behavioral therapy is also a necessity. This will enable me to reshape some of the thought patterns happening that lead to violence and outbursts. CBT will also allow me to reshape the God complex into a more normal and sympathetic thought process. A biological treatment will be the most difficult to prescribe since antisocial personality disorder can't be treated chemically as a whole. Anticonvulsant mood stabilizers could be used to mellow the client down in that area, but most of the progress will be made through talk therapy and CBT. For a combined treatment, appointing tri-weekly psychotherapy sessions will be the most important part of the treatment. Also, prescribing mood stabilizers are important, but only a little to avoid substance abuse. Psychotherapy and talk therapy and CBT will be the best way to help with this client's issue.